Today we're going to show you how to help your patients regain their strength, skill, and confidence for active balance and walking. With BT's philosophy of isolation to integration, we're going to start by strengthening and conditioning each major joint movement independently and progress to a full walking exercise so your patients can get up and get moving safely, confidently, and independently.
Hi, I'm Colleen from BTE's Therapy Spark. PT and OT associations around the world are calling therapists to focus on their clients' mobilization and independence in the face of COVID-19. Today, I'm going to show you a new way to rehab COVID-19 patients with your BTE PrimusRS. We're going to start by strengthening the knees, ankles, and hips in isolation. Then we'll progress to a full walking exercise. Each of these exercises emphasizes eccentric contractions. That way, they'll be able to do more repetitions with minimal strain. Whether they're deconditioned or suffering from cardiorespiratory limitations, this treatment is safe for early intervention. Let's get started. Let's start with isolated controlled movement of the ankle. We're going to do the plantar flexion dorsiflexion as well as the inversion eversion. For this, we're going to use the plantar flexion dorsiflexion attachment. Position your client so the axis of rotation is lined up on the outside of the ankle. First, you'll need to determine the right amount of force for each client with a quick isometric assessment. Simply have the client complete the movement giving their best effort, and the system will automatically calculate 30% of that force as the starting resistance level. You can change this percentage however you need for each individual. Since we're focusing on eccentric contractions, the eccentric force will be higher than the concentric. Our client will now concentrically go through the range of motion with controlled movement. When they reach the end of that range, they will most likely slow down and reduce their own force output. At this time, there will be a greater opposing eccentric force that the client will have to control as they move the joint back towards the starting position. For the ankle eversion inversion, the basic parameters are the same. Start with a baseline assessment, change the force ratio to higher eccentric resistance, and guide the client through the exercise. Next, we'll isolate the knee motions of flexion and extension. Isolating the quadriceps and hamstrings eccentrically is key to building the strength needed for walking. Using the Primus chair, set up your client so that the axis of rotation is lined up with the knee. Make sure that the client is secured to best isolate only the knee. The back of the tool should be away from the edge of the chair, and the shin pad should be positioned comfortably on the lower leg. We'll do a knee extension first, since this is easier for the client to do, and it's easy to assist them. Just like with the ankle exercise, you'll need to do a baseline assessment, and then change the force so that the eccentric is higher than the concentric. When they start the exercise, they'll feel tension in the quads as they extend the knee. Once they get close to the end of their range, they'll feel the added force on top of the shin. This is the increased eccentric load. They'll need to slow down the movement and control their force until they reach the starting position. For the seated knee flexion, simply move the shin pad to the posterior side of the lower leg and secure the thigh strap. Again, you'll want to start a baseline assessment and adjust the eccentric force. You can do the knee flexion while seated or lying down. The prone position is best to avoid artificial support of the hamstrings. To do this exercise in a prone position, fold the Primus chair down flat and have the patient lie down. Many clients find this more comfortable, and it also gives more isolated gluteus and hamstring activation compared to the seated position. As we continue up the kinetic chain, we'll now start some standing hip exercises. You can do hip exercises in a couple different ways, and today I'm going to show you how to use the lever attachment and the cable system. For the lever attachment, place the pad just proximal to the patella. Since we're working on the hip, we're going to use the greater trochanter as our guide for the axis of rotation. Your client can balance themselves using the Primus chair. As they become more stable and comfortable, move the support farther away from them. The Primus cable system offers multi-directional movement. For this exercise, you will need to have an ankle strap that fits around the lower part of the leg. As always, start off with a baseline assessment to determine each client's starting resistance. And for this program, increase the eccentric load. Now that we've strengthened the ankle, knee, and hip in isolation, it's time to integrate these movements into a functional exercise. By now, the client should feel confident with their improved strength and balance. Now, we can start the walking exercise. First, we'll walk in a straight line. Then we'll further strengthen the hips and core by walking backwards and laterally using the cable system. You can target several different parts of the body with this exercise, depending on where you place the straps. A waist strap can target the core and lower extremity more equally. Placing one strap around one ankle can focus on the hip flexion or hip extension. And using the bilateral handles can allow a person to work on walking while simulating pushing a cart. For higher load eccentric walking, we're mainly going to use the waist strap. As we're walking away from the system, we are concentrically exercising. With the higher eccentric load, our client will feel a pulling motion when they stop, which adds to their proprioception. By strengthening the ankles, knees, and hips in isolation, you can build your client's strength and balance to regain their independent walking ability. The PrimusRS allows you to progress from isolated exercise to functional movement for a better rehab experience.
Now more than ever, physical and occupational therapists need to focus on restoring their clients' mobility and independence. At BTE, we're committed to helping you provide the best. That is why we're here at our production facility every day, building the systems that make better clinical outcomes possible. Clinics across the world provide a better rehab experience with BTE. I'm inviting you to join our mission and share your rehab success stories with us on social media at BTE Tech. Grab your phone and send us a quick video about your rehab solutions with BTE. Thank you.